we'll get into the menu set of meaningful use objectives. So the first one is a current capability. That is just having the drug formulary checks turned on. Incorporate discrete clinical lab results into an EHR is 9.5. So we had to put in some new items into the system so that you could actually record that information into the system. If you have an interface, you're going to be able to bring that information in as well. Generate patient list by condition. So remember when we were talking about those problem lists and doing those by actual ICD-9 codes? This is where you might want to put those in because you're going to have to be able to retrieve patient lists by condition. The patient list is an actual current capability, and that's done through the patient inquiry, if you guys are familiar with that. The other item here is number 4, which is send reminders to patients per preference. So those two are kind of together, the list and the reminders, because you can actually send out the reminder list based off of the list that you create. So you can send patients a bunch of letters based off of the list. So that's what those two are talking about. And that's a brand new 9.5 enhancement. Provide patients with electronic access to health information. That's WebView or Patient Portal if you have one of those. Use EHR to identify patient education resources. So this is where, if you're using patient education, this is where you can get credit for giving those handouts to patients. Perform medication reconciliation. This is where you're going to be able to document it per paper, medication reconciliation, or the electronic CCR CCD. Provide summary of care record on transition. That's also a 9.5 enhancement. So that is going to be when you're going to be providing another provider with a summary of what you've done in your office today. And then the last two, 9 and 10, are the ones that you have to pick one of these. So you either have to do submit data to immunization registries or submit surveillance data. So you have to pick one of those. That's why they're starred, because they're important. And those are both 9.5 enhancements.